During the August recess, I held two 21st century cures roundtables in my district. I heard from patients and some of their problems. I also heard from providers and some of their problems. There were two themes that came up: outdated payment policies and also the barriers to innovation. I'm glad that we're holding this hearing today because the specific issue of FDA regulations of labs, developed tests, was one of these issues that came up. We had a company talk about their concerns that the FDA's regulations could slow innovation. At the end of the day, we want safety, of course, but we also want to keep innovation products to get to the market. If we don't, then the patients, in my opinion, will suffer. Dr. Shuren, I have a couple questions. Has FDA done a thorough economic analysis that considers the direct cost to laboratories and taxpayers if FDA goes through with their guidance?
So we don't have a formal economic analysis. On the other hand, we also hear from labs who say, well, when we make tests, we validate them. CLIA says they're supposed to be validating those tests when they make them or they modify them. And so if that is the case and they have that data, the cost should be a lot less to be able to then provide that to us.
Thank you. Under the Regulatory Flexibility Act, the RFA, federal agencies are required to assess the impact of their regulations on small businesses. The analysis should include such things as how many small businesses there are, the projected reporting, record keeping, and other compliance requirements of the proposed rules, any significant alternatives to the rule that would accomplish the statutory objectives while minimizing the impact on small entities. And it requires agencies to ensure that small businesses have the opportunity to participate in the rulemaking process. However, if FDA goes forward with guidance and not formal rulemaking, it undermines laws that protect due process, such as the RFA or the Administrative Procedures Act. Will the FDA go through with the traditional process of rulemaking?
No, because this is a policy of enforcement discretion. The requirements are already there. They're subject to the requirements. We're not imposing that. We have, as a matter of policy, decided not to enforce them. We are now changing that policy and enforcing requirements in certain cases. Those general policy statements under the Administrative Procedures Act are not subject to rulemaking and actually has significant impact if they are for our ability to do so. However, as part of the process with guidance, there is a public process for small businesses and others to weigh in, not only on the docket and written comments, with public meeting we will have, meetings that are occurring in other venues and other discussions. Some groups have already been in talking with us about the framework, and we will have that dialogue. What we hope is, though, is that people will come and talk to us, that the lab community will be in the door and have those conversations. Some have. We'd like to see the full community come in the door, not talk about, we provide services, these aren't IVDs, don't regulate us, but rather come and say, okay, we get it, but let's figure out how to do this right, because we think labs developing tests is a good thing. We're not here to stop that. We're here to try to have that balance between the development of new tests, but also tests that work, making sure it's safe and effective, because there's no value to doctors and patients if the test doesn't work. That hurts people, and that's a cost on our healthcare system.
How many labs would suddenly fall under the FDA authority under the proposed guidance?
In part, we'll see that with notification. We're estimating that number. We know for the labs who can make LDTs, who are allowed to, according to CMS, that number is 6,000, but not all of them make LDTs. That number is much smaller. And we think a number of these LDTs are also subject to the continued enforcement discretion. So for some of these labs that are making tests that, again, they're not coming in the door for us.
I've heard concerns that some of the guidance that FDA issues may be duplicative or contradictory with the requirements of under CLIA. Will FDA ensure that its guidance will harmonize with the current regulations required under CLIA?
Yes, and in developing our framework and other materials, we have been coordinating with CMS. Our goal is not to be duplicative.
Thank you very much. I yield back, Mr. Chairman.
Chair thanks the gentleman, and now recognize